Welcome to the Health Deli, your local stop for a fresh take on community health topics. Come on in, grab a number, and let the guys behind the counter, Mark, Ben, and Mike, tell you about today's specials.
Good day and welcome back to the Deli. It's another glorious day up here in the Health Deli studios in the Ferris State University Television and Digital Media Production Facility. And I would like to thank Andrew Tingley. Andrew, say hello.
Hi.
For inviting us here. I would like...
Stop messing with your feet because you're making some noises.
Sorry, I was fidgeting. It was making me nervous being nice to people. Okay, I'm back.
It's definitely not your norm.
I'm back to me. Mark, piss off, bugger.
How are you?
Yeah.
I'm excited for this episode.
Shut up. Nobody asked you anything yet. So this is going to be a glorious episode because we're going to talk about something that we've alluded to in the past. Things that affect health and health outcomes that aren't necessarily things we think of like drugs and stuff like that. Mm-hmm. And so these are called the social determinants of health. And we're going to have a colleague, Dr. Katie Axford, talk about it. Say hi to the folks, Katie.
Hi.
And so before we get into Katie, let's hear a little bit about, Mark, what worthless topics you're working on for the future.
Worthless. Wow, you are bringing the heat today. A couple things. I'm working on an episode about aging, like how to live to 100 plus years old.
It's hate. Hate, because it keeps you warm, keeps people away.
Right. And we're gonna draw a lot of Mike's knowledge and how he got to be 100 years old. And talk about some other factors. Also, caffeine. So, friend or foe, we'll learn about a little bit more about caffeine and how it impacts our lives and health, I guess.
All right. Andrew, do you have anything that you're working on for the deli or want to hear Mark not talk about?
Well, after our technical issues from the last deli, I sent that switcher back, so we're not going to use that anymore. We're going to use the equipment that we trust, and we're just going to produce a good show. So I'm looking forward to listening to this one.
I think he's saying he's looking forward to listening to me. That's where I read
Katie.
that.
No, exactly.
I want to hear Katie.
Bleep. Well, all right. So I'm still working on a variety of things as well. I still want to look at outpatient antibiotic use and how things that we can do, in terms of being compliant with medications, healthy lifestyles can decrease our risk for needing antibiotics. Also want to talk a little bit about questions from my peer group.
Like nursing home residents.
Yeah, those with one foot in the grave. Yeah, pretty much. I want to hear what we think about things, and so that I think that'll be good.
That's good. What about how you been feeling? I know that you've been battling your ear issue.
Yeah,
you better.
Well, so I think this is a great point for the Klepser Health Aged Health Condition update.
I have a special podcast just for your health condition.
I know we talked about my prostate last season, Katie. You missed that. That was
Thank God we're done talking about that.
Yeah. And so now, I've been diagnosed with Meniere's disease, which is a condition that affects my ears. And so I have problems with my balance and vertigo.
That's when you're diving and you come up from the water too quickly.
Okay, so I know that we wanted to have you have a microphone, and now I just regret that.
I think that's the bends.
Could scurvy.
Yeah, they're all similar.
All right, so I'm doing well.
Good.
Let's just.
You were eating no salt or something? Are you sticking to that or no?
Well, yeah, actually, I do.
Seriously?
I have to be in a low salt diet.
But are you actually doing it?
Theoretically, hold on, let me talk a little bit here. Can we cut his microphone?
Please,
Otherwise,
yes.
we might have to cut his throat. Violence is not condoned on the Health Deli. So yes, I have to do a low salt diet. I can only have between 1.5 to 2 grams of salt a day, and that's supposed to decrease the amount of fluid that's produced in my ears and hopefully help my hearing. Mm-hmm. And I've got an app, free app. It's called the Dash Diet app, and I'm able to track the salt in different foods and stuff like that. And I've actually, to my surprise, been very good at it, even though I have to give up a lot of the things that I love in life, like bacon, egg, and cheese biscuits. Yeah, because right there, one of those has more salt in it than I'm allowed to have in an entire day.
Yeah, probably no jerky either.
No jerky. And so, wow, that was really a depressing way to think of all the things I can't eat. Let's go back to Katie. She looks like she's incredibly happy to be here. Dr. Axford, can you tell us a little bit about yourself and what makes you different than Mark and myself? Besides the obvious.
I was going to say, a lot of things make me different.
I mean, the obvious of being
most
happy.
Most of them good.
She's very intelligent, for one thing.
Well, thank you. I think what you're alluding to is that, so I'm a pharmacist by training, just like Mike and Mark and Ben. However, I, within the last few years, went back to school and got my master's degree in public health. So I had a real interest in learning more about public health and becoming a little bit more of an expert in that area. And so that's been something that I've been able to bring back to the college and to our students as a little bit more public health perspective in addition to pharmacy stuff.
So what exactly do you mean when you say public health? I mean, is that just the health of the public? Is that pretty much?
Yeah, kind of.
Okay.
So in traditional medicine and really like what we focus on in pharmacy, we're worried about the individual patient and we spend most of our time treating disease. Although we certainly have gotten into a lot of preventive care and things like that. But public health is really focused on the health of the community as a whole. So focused more on preventing disease, illness, doing things to make the community overall healthier. And sometimes that means making interventions that are for the greater good and may not be what an individual person needs or prefers, but overall has a positive impact on the health of the community.
Okay, excellent. And so just that is kind of a different approach than the rest of medicine, as you alluded to, because usually I've got a patient in front of me and I'm managing their health. I'm trying to react to whatever they've been diagnosed with, trying to adjust their medications and stuff like that. And
it's very personalized, right?
Yeah.
Each individual patient has different needs and different medications.
Mark is very needy.
Yeah,
very
as
needy.
are you. So
Well, we just did an episode on health economics, and there's more money in treating diseases than there is in preventing them.
Absolutely.
So
yeah, and it's a lot easier to see the impact when you treat a disease and a person gets better than it is if you prevent it from happening in the first place. So I think a lot of times public health is under recognized. Because we're preventing something from happening in the first place.
That's a really good point because, okay, if Mark has lesions on his face.
Legionnaire's disease.
Why are you talking like a pirate today?
Today's
Pirate Day in the Deli.
scurvy, Legionnaire's disease.
Wow, that was lesions, sores, open wounds, oozing pus from his face.
Leprosy.
Yeah. So we could, if we cure that, I mean, you want to get rid of that and you value whatever treatment.
You're right.
But unless you've had, these lesions and I say, hey, you should be doing this and we can prevent these lesions from occurring, you'd be like, oh, why do I need that? I'm not going to get lesions. So I can see how people, why should I change what I'm doing? That just seems inconvenient for me. And unfortunately, that's kind of the world we live in. Is why me? Why do I have to change? You change.
Sure.
And so that's kind of what public health is struggling with, a lot of those preventative things, right?
Absolutely. Yeah.
Okay. So let's talk about why you're here.
It's because you made me be here.
Fair enough. I have that kind of power over people. I cry a lot.
Well, I will say thank you for being here because otherwise it would just be Mike and I. And, if we can gang up together, right, we can. And the pirate.
Andrew the Pirate's here today. Wow, I am having a hard time staying on track with all this background noise. Oh, wait, that's Mark.
That's okay.
So we talked about air pollution.
Yeah.
And it was an interesting discussion because, at first I was thinking, why are we talking about, air pollution with this dude and stuff? But then he started talking about things like, doing studies about schools that are next to highways or, how, the fast, pass things, when you just keep zooming, you don't have to stand there and all the exhaust, how air quality improves and how individuals' cognition, health, and other things improved, with those type of things that you wouldn't think of, hey, I'm going to do this and it's going to impact somebody's health. And I light one eye and go, wait, those are social determinants of health.
Absolutely.
You know, we should talk about those kind of things. And Mark's looking at me right now and I'm thinking, yeah, Mark is more interested in the antisocial determinants of health.
Ooh, that could be another episode.
So, Katie, help me out because I pretend to know a little bit about public health. But you all are just like giddy when anybody says social determinants of health. She loves her some social determinants of health. What exactly is a social determinant of health?
Yeah, so social determinants of health, or we call them SDOH sometimes, which I don't know if that's much shorter, but these are the non-medical factors that influence health outcomes. So it's conditions where people are born, they grow up, they work, they live, they age, and kind of the bigger set of forces and systems shaping the conditions of daily life. That's like the official definition of social determinants of health. So when we think and break down, there's a lot of different numbers out there, but current estimates are that about 10% of what happens to us from a health standpoint is based on our biology, our genetics.
Only 10%?
10%, yeah, right? Another 30% is probably based on our health behaviors. So whether we choose to use tobacco, use alcohol, exercise, wear a seatbelt, those kind of behaviors and choices that we make. And the other 60% is based on kind of non-medical things around us that we may or may not have a lot of control over, but that impact how healthy we are, how long we live.
So more than half.
Yes.
Wow.
Yeah, 50 to 60%. So at least half, I guess we can safely say.
That's amazing.
Yeah.
So when you say like influence health outcomes, what do you like mean by that?
Yeah. So how likely you are to get a certain illness, develop a disease, how well you're able to manage that disease if it develops, and ultimately really how long you live and when or how you die are all kind of examples of health outcomes.
Wow.
Yeah.
And so help me with this, because you mentioned that conditions where people were born, grow, live, work, blah, 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 whatever. Sounds like everything. So it sounds like me being me influences my health.
You being you, where you are at influences your health.
So next to Mark, you mean negative impact. You are a negative social determinant of health, Mark, is I think what she's saying.
I'm a good influence, I think.
Yeah, keep thinking that.
It's not like I'm handing you cigarettes and beer right now and handfuls of salt.
It was last night.
Wow. Yeah.
So, all right. So all these things could impact my health, and what's meant by health is like a lot of things. Can you give me some examples? Like, how do the social determinants of health influence the outcome? Like, what links have been? So we mentioned like the air pollution stuff, and air pollution influences cognition. Who would have thought that was going to, relate, to each other? I guess I wouldn't have.
Yeah, there are a lot of different, so a lot of public health research goes into kind of identifying these connections and helping figure out how these different determinants can impact. Because the more obvious things, right, we could think about is that if you live in an area, grow up in an area with higher air pollution, then you're more likely to develop asthma or other lung diseases. Our neighborhoods are a great example. So if you live in a neighborhood where there are high rates of violence, or there aren't sidewalks, there aren't parks or green spaces, individuals who live in that type of community may be less likely to go outside. They may be less likely to get physical activity, and so then they're less or more likely to develop chronic diseases like heart disease and diabetes. Whereas someone who grows up in a really safe neighborhood where they're able to get out, play, exercise, then they're less likely to develop those conditions.
So we always used to like say things like, socioeconomic factors and stuff like that, but it doesn't sound like it's always the money that relates to it, but the money might affect where you live, what you eat, how you exercise. And so it's just much more than money.
Absolutely. So, social determinants of health are kind of divided into 5 key buckets currently. So, economic stability is one of those, and so that's things like what is your socioeconomic status? Are you able to get and maintain a high-paying, safe job? Do you have housing security, food security, those types of things? Education access and quality is another bucket. So, do you live in an area where you have high quality schools, and so your children can grow up and get a good education, be likely to get into college, and then again transition into a good job?
So how much education you have can impact your health.
Absolutely, absolutely.
Amazing.
Both directly and indirectly, I think. So, healthcare access and quality is another one. So, if you live in a really rural area where you maybe don't have access to primary care, preventive care, a dentist, optometrist, those types of services.
Access.
Yeah. So, the care that you actually receive is one thing, right? And that certainly has an impact on health. But whether you can even get your foot in the door in a healthcare facility that you need is a social determinant of health.
So that's all. I mean, that's a lot.
Yeah.
I mean, so how do you track that? How do you use that? I mean, so we talked about, too bad Ben's not here because he talks about study design all the time and controlling for variables. It seems like you would need to do just such a detailed history on somebody to know what all their social determinants of health would be. And there would be absolutely no way to control for all of that, in a study. And this could influence, like you mentioned, incidence of disease, a response to a medication, a variety of other things. Like, so do people hate you because you came up with all these variables when it was just so much easier before we had to take an account for these variables? Oh no, I've just lumped all of you and social or public health folks into one big lump right now. And so is that why people hate you?
I hope not. I mean, I think you bring up a good point, right? We can't do a lot of randomized controlled trials trying to change the conditions that people live in and seeing how those affect them over the entirety of their life, right? The logistics of that and the amount of money that it would take is just not reasonable. And so a lot of public health research is really observational and trying to kind of lump people together in similar conditions and see the rates of disease in a certain community and try to parse out what factors might be impacting that.
So as long as you don't lump me in with Mark, it's okay. That's not a lump I want to be in with.
I think you live in pretty different communities, so I think you're safe.
Safe from Mark. So, again, what do you do with this? I mean, You can say everything impacts your life, and as public health, how do you take that? I mean, you can't move people out of their life.
Sure. Yeah.
So what do you do with the information? Just like, it sucks being you.
Yeah. So first of all, I think it's important to not lump all of public health together. So there are a lot of different people and groups in the public health sector that are working on improving the health of all of their communities. So a lot of community health organizations, local public health departments, things like that. And so I think there are a lot of initiatives out there that try to tackle different disparities as they're identified, and really create access and just improve the quality of life for the individuals in their community. So, for example, if we go back to that neighborhood example, maybe a community organization comes in and builds a recreation center so that kids in that community have a place that's safe where they can go and engage in activity. And so,
see, and that's interesting because you just said that, and all of a sudden mine go, build a rec center. That means they're going to get more exercise. But what you're saying is, no, it impacts so much more than just their exercise because it gives them someplace to go that's safe, so decrease violence.
Yep.
So life expectancy, it might go up because
Absolutely.
no violence. They're there maybe getting additional education or mentoring. So long term, they're having increased access to education. I mean,
Build relationships.
Yeah. So just this, this fitness center or whatever, community center does so much more than just superficially on the surface, what you would think.
Yeah. So social and community context is another like bucket of social determinants of health that we didn't touch on, but that both of you just talked about. So
Hey, look at us. We're like
Look at
public.
you.
We're like public health
and
people.
this is
Nice.
the thing. Like, I don't know that a lot of people. I think social determinants of health in general we have a growing awareness, but it's not a new concept. But I think it's kind of a new fad, maybe, to actually think and talk about it.
So does that mean?
But really,
are
as you
Mark and
talk
I
about
hip?
it, you're hip. Yeah. Yeah. Welcome to the cool crowd. But as you talk about it, a lot of it is like, well, yeah, like that makes sense. So do you have connections? Do you have somebody that you can call to watch your kids if you need, if somebody's sick and you have to go to work? Do you have mentors? Do you have,
I like to think I'm your mentor, Mark.
So
so it's like social capital,
you'd
right?
like to think a lot of things.
And other things like discrimination, racism, sexism, homophobia, those fit into that social and community context too, and can have huge effects on both physical and mental health, depending on the rates of those types of isms in your community.
And I said this is kind of like a newer thing, and Mike and I are on the cusp of the
Cutting edge.
breaking edge,
the
yeah.
cutting
Cutting
edge.
edge, yeah.
But is this something that your healthcare provider does an assessment for? Like when you go to the healthcare provider, they're going to make sure they know what medications you're on. They're
Yeah.
going to give you a physical exam and check your blood pressure. Are they going to
Do
consider this?
Social
like,
determinants of
intentionally?
health exam.
Yeah. Are they going to do something like that?
Yeah. So actually, I actually recently just had to go to see my primary care provider. And as I was kind of doing the online check-in on my phone before my appointment, I did a social determinants of health assessment. So it asked me questions like, do I have food insecurity? Do I ever have difficulty, paying for food? Do I have housing security? Do I rent or own my home or not have a home?
See, I wondered why those things were there because I thought it was just kind of intrusive
being
and
nosy.
stupid.
Yeah. Nosy.
Yeah, no. So, I think, again, this growing recognition that these things are really important and that if your patient doesn't have access to food, then they're probably not going to pay for their medications, right? Sure. And if they don't have reliable transportation, then they're late for their appointments, not because they don't value that time or think it's important, but because other life things are getting in the way and making it difficult. And so I think that our healthcare system as a whole is gaining a better recognition of that and really trying to take those things into consideration.
Well, let's think about that for a minute, and we'll think about it while Mark is giving us some information about the Healthy Minute.
Yeah, let's pause for the Healthy Minute, brought to you by the winery at Young Farms. Today's Healthy Minute is schedule an eye exam. Our eyes are not only windows to the world, but also essential indicators of our overall health. Regular eye exams go beyond just assessing vision clarity. They can detect early signs of various health conditions, such as diabetes, hypertension, and even certain neurological disorders. Early detection allows for timely intervention and management, preventing potential complications. Moreover, vision changes can occur gradually, and people often adapt without realizing that their eyesight has deteriorated. Routine eye exams help in identifying and addressing these changes promptly, ensuring that you enjoy optimal vision for all aspects of your life, whether it's work, driving, or simply appreciating the world around you. I encourage you to prioritize your eye health by scheduling regular eye exams. It's a simple yet powerful step towards maintaining your overall well-being. If it's been more than 2 years since your last eye checkup, consider making an appointment with an optometrist for a comprehensive eye exam soon. That was the Healthy Minute, brought to you by the winery at Young Farms in Mecosta, Michigan. Please visit www.thewineryatyoungfarms.com for more information. Now, back to the Health Deli.
Boom, chicka, boom, healthy, 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 healthy. So I always thought the eyes were a window into your soul, and that's why mine were so dark and hollow looking.
I try not to look at you directly because I'm afraid that you may somehow extract my soul.
Yeah, we can go with that. Fear is good. So, hey, on a lighter topic, social determinants of health, and our guest here is Dr. Katie Axford. And we've been exploring how some of these things that you really don't appreciate impact your health. And not only impact your health, but impact maybe your response to medications or how you're able to get access or what you know about things. And so this is a lot.
Yeah.
And so public health, they've got this social determinants of health,
Yeah.
which seems like it encompasses everything. And I'm sure that you're asked to do something with social determinants of health. Think about change, think about things to monitor to try to impact public health.
Mhm.
So how, and again, I've learned about the Healthy People Initiative, and
Sure.
that's not a new thing. That predated the social determinants of health.
That predates me.
It doesn't predate Mike.
It doesn't predate Mike.
Nothing
no.
predates me.
It's less than 100 years.
There are rocks that don't predate Mike.
And I like those rocks. They're good friends. I've nurtured them from little pebbles.
Yeah.
So healthy people.
Yeah.
And so I know that these are things that public. Well, first of all, maybe I don't really know what the Healthy People Initiatives were meant to do. Can you explain what these healthy initiatives are? Healthy People Initiatives.
Sure. So Healthy People Initiative was started by the U.S. Department of Health and Human Services in like 1979, 1980.
Those were good years. Very good years.
I have to take your word for it. So they are 10-year national health objectives that are set for the United States, for our whole country. And it really takes all of the disparities and the health issues that have been identified and breaks them down into tangible objectives, measurable, doable things, right?
So
because you're right. If you look at social determinants of health as a whole, it's very overwhelming to think about trying to tackle that, right? So we have to break it down into smaller kind of how to eat an elephant one bite at a time. I think is
first-
I've never had elephant.
me neither, but that's what I hear.
I would think you have to catch it first.
Are they fast?
They're
Anyway.
big. They're big.
Okay, so so what Healthy People does is they establish kind of baseline levels, which are often based on kind of national surveys of people who live in the United States. They set goals and then they monitor progress over time towards improving the health of our country.
So do these Healthy People Initiatives, we've looked at the data. We think here are some problem areas that we should address. And this kind of, you mentioned they come out in 10-year increments or so. Does this kind of give public health its walking orders or marching orders rather, saying this is what you should focus on?
I think so, yeah. Like it's really overwhelming as a public health practitioner to come out and say, like, where do I even start? And so Healthy People gives us a place to say, okay, here's something that I can impact in my community. The Healthy People website is chock full of resources, also to help people who are interested in doing this work. So it's a really valuable tool, I think, toolbox really, for people who want to improve the health of our communities.
So what are some of those goals?
Sure.
I know you sounds like there's many, but I don't know. Can you give us some examples, maybe?
Well, first off, if they come out every 10 years, do things change or do they just keep adding stuff on? If they did good, they go, yeah, celebrating public health has a party, and then they change their goals and say, oh, no, still a lot of work to do. Get back to work?
So I think a little bit of both. So if there are objectives from a previous 10-year time period that we haven't made enough progress on and we think they're still important, and I'm using we obviously very liberally here, then we keep those and we keep doing that work. Others where we've met the goal, it may move into just kind of a monitoring status. Or it may just be kind of retired. Actually, there was a pretty significant...
I want to retire. I want to retire so bad.
I want you to retire.
There's a pretty big overhaul between Healthy People 2020 and Healthy People 2030, because by Healthy People 2020, there were a lot of objectives, and it was almost equally overwhelming because there was just so much. And so for Healthy People 2020, they really pared it down and tried to decrease the overall number of objectives and make sure that we were focusing efforts on kind of the biggest health issues in our country.
Mark is one of my biggest health issues.
Yeah.
Yeah.
Like scurvy, right, Andrew?
Right. The pirates are back. And so then, to Mark's point, what did these focus on? Can you give us some examples of areas that Healthy People and, what are some of the goals? Do do I know any of these things?
Yeah, so I recently watched the episode on breast cancer that you all did with Susan from our college, and so increasing the proportion of females who get screened for breast cancer is a Healthy People 2030 objective.
So do you mean our episode was raising awareness and we were helping with social?
You were helping
Hey, brother.
with
What?
social determinants of health.
We're public
Yeah.
health.
Do you think someday that the kind of sixth, because you said there's kind of 5 areas of
Yeah.
social determinants, do you think there could be a sixth that is maybe listening to the Health Deli?
Maybe.
Whether or not.
That would be awesome.
I'll look and see if there's a place to submit suggestions.
Yeah, put that in. That could be an initiative.
Yeah, sure.
Increase
We
listenership
can
listenership
see,
of
I can
the Health
see.
Deli. Okay.
Yeah.
So back to some of the actual objectives and topics and stuff.
Yeah. So just for example, so the most recent, or so the baseline data that was used for that objective showed that 76.2% of females age 50 to 74 had been screened for breast cancer in the previous year.
So that, doesn't sound bad, right? You said 76.
76%. Yeah.
And did they have like a specific goal they were trying to get to?
Yep. So the goal that was set for 2030 was that just over 80% of females in that recommended age group would be screened.
So that doesn't sound like a heavy lift. That sounds reasonable.
Right. And that's, I think, intentional, is that these are ambitious but realistic.
But you could look at it from the other side and go, well, we got 76%. That was the easy stuff. And now getting these last few percentages, that's going to take a lot more time, effort, and resources.
Well, and if we think about it from a social determinants of health perspective, that 24% who hasn't been screened, why is that? Is it because they
haven't listened to the Health Deli?
They haven't listened to the Health Deli, maybe. Or maybe it's because they live in a rural community where they don't have access to mammograms. Or maybe it's because they don't have transportation to access health services. Or maybe they are part of a cultural community that is skeptical of the healthcare system and they're resistant or hesitant to engage. And so I think that's where social determinants really come in, is trying to identify the group that we're not reaching. Why is it? And how do we overcome some of those barriers?
Man, that sounds like it'd be intense then to so you listed off a whole bunch of potential reasons. Before you even start to move forward to change the number, you got to understand truly what is driving this, or if it's multifactorial. So, sounds like there's a lot of work to do just before you can even do any work.
And that really has to happen at the community level, right? Because each community is different and the barriers that they are facing is different. And so we have these goals as a country, but as individuals and as individual communities, we kind of have to each do our part to identify which of these goals are really relevant to us, and what can we do to move the needle on them.
So it's not like, these Healthy People things come out and go, everybody must do everything and show progress.
Right. So they say, here's where we're at, here's our goal, here are some resources that can help us move the needle. And then, the individual communities are the ones that need to do the work.
So it sounds like there's a population aspect to it where we're trying to move, the entirety of a certain population to make them more healthy. But then there's also the individual at the patient level. Like, what can I do to help this person in front of me get a mammogram?
Yeah.
But then what can I do to move the needle so that more people in this community get mammograms or whatever it is?
Well, from the perspective of what public health is, unfortunately, public health is incredibly underfunded in the United States. So, I like to think of public health like an onion. So there's the outer
I
layer.
See you're begging me to ask the question. Why is it like an onion, Mike?
So there's the outer layer, which is public health, but they can't reach, things at the inner layer because they, don't have the reach. Or maybe they're the inner layer and they're working out. They're one of the layers.
Okay.
But they need more layers to reach more people.
And as you peel those layers back, you start to cry?
Every time I walk in this room and I start to cry. But they rely on other people to make, maybe they're, okay, so there's the center layer, they're the core. And they rely on other people to grow so they can have a better reach. And you keep mentioning at the public level, at the community level. So in the United States, our broad public health group is the Center for Disease Control and Prevention. I've never seen one of those dudes walking around my neighborhood.
Yeah.
And so they're not influencing things at my level, but I do know that I've got community public health workers. I do know that I have volunteers that are picking up garbage. I know I've got volunteers. So we all have a role to kind of carry out what's been put forth by, the agencies up here of given direction.
Yeah.
And so that allows the communities themselves, like you mentioned, to prioritize what's important to them, because the money to do a lot of that stuff is going to come at the community level. So if, making, wider sidewalks was an initiative and that's not important to my community, I'm not going to waste the money, but maybe increasing, access to safe after school programs is. So I get to choose. I mean, so that's kind of cool.
Yeah.
So it kind of unites the work that's being done, in small pockets everywhere towards a more common goal. I like that.
Kind of like an onion.
It's similar, and it makes me cry.
And I think it's important to recognize, too, that we can also make a difference at the individual level, right? So each interaction that you have with one of your patients as a pharmacist, if we can help make them healthier, they're still part of the community, and that's improving the health of the community, too.
Well, think about it like smoking cessation, right?
Yeah.
So we tell everybody to quit smoking, of course, right?
Yeah.
But it's not as easy as just say you shouldn't smoke.
Right.
Because everyone knows it's bad for you. All the people that smoke know it's bad for you. But peeling back the layers, thank you. Peeling back those layers and understanding, why they can't stop smoking is important. And I didn't realize that I guess I use social determinants of health. I don't call it that, but I do use that in my practice. So.
Yeah.
And so beyond healthcare providers, which, again, we have limited reach, are these kind of social determinants of health and healthy people initiatives, are these some things that people in general can get involved with and can do and should be aware of to improve the health in their community? Or is this just solely for us who hold the keys to the website?
No, absolutely. I think it's important for all of us to recognize social determinants of health. One, because I think it gives us more grace for each other, right? And we treat each other better if we are not Mike, and if we recognize
Actually cared about others.
If we actually care about people.
Don't care. Again, I'm the anti-social determinants of health.
But something we haven't talked about really at all today is policy, and how much policy and legislation can impact public health are related to social determinants of health. And so that's something that I think anyone, any of us that vote, that pay taxes, we have an opportunity to impact social determinants of health in our communities. And so I think it's important for everyone to understand.
And so we can do that at the community level. And then getting back to Mark, I know providers, healthcare providers, we use social determinants of health. We ask the questions, like you said, when you checked in. But what if they're not? Should patients take the initiative and provide information that they believe is important to their health? And how do they get their healthcare providers to care?
Yeah. That's a really hard question. And I think not all patients will be comfortable sharing those things, or maybe don't even recognize how some of their life situations are truly impacting their health. And so I think if you are a patient who has something going on, sharing that as much as you can with your healthcare provider is very helpful. But I do think most of the onus is on the healthcare team to ask the questions.
But you think healthcare folks would be open to hearing these because they understand?
I hope so.
Okay.
I mean, it's hard to lump all healthcare folks into one bucket, right?
Because not
we're
everybody's
all
like
people
me.
and we all have different personalities. And but I do think, I work with a lot of medical learners, and I would say our healthcare system, our healthcare teams in general, are really embracing this and recognizing the importance. And I think as we go forward, we're going to be better for
So
that.
I think from my perspective, I would recommend, based off of what I'm hearing from you, healthcare providers should know about social determinants of
Absolutely.
health. And so encouraging patients to talk about things that concern them
Yep.
is something that they should do, because the providers should be aware of social determinants of health and could use some of that information potentially, and it might make a big deal.
Yeah, and as a pharmacist, I mean, all pharmacists have had situations where a patient will come in and they'll be angry for whatever reason, and they'll be talking about their car broke down or their cat is sick, and it's very easy to tune them out and say, "Oh man, I don't want to hear about this person's cat. I don't want to hear about this person's life, really." But that all is impactful to that person's health.
For sure.
So that information you really shouldn't squelch out. You know,
Man, that's heavy stuff. I see. I
job.
prevented us right there. I didn't say shit.
Good job.
So with that, I think this has been incredibly interesting. Really gave me more insight in terms of, like Mark said, I do some of this stuff and I've seen it done, and I have done it for my career, but I haven't called it social determinants of health. And so I understand now this isn't necessarily a new thing. We just gave it a new name. So we can easily classify it and go forward. But this is really important stuff. And, Katie, thank you so much for opening our eyes and teaching us. I hate to say that, yes. Yeah.
I think we're going to see a kinder, gentler Mike.
Bleep that.
And going forward after this episode, I think we've opened his mind just a little bit.
We'll see.
Yeah, don't hold your breath. But I have not made fun of you. I probably have.
You in the last 30 seconds, maybe.
Am I going to get emails from your wife?
Most likely.
Okay. All right. Well, hey, before I insult Mark anymore, Katie, thank you for being here.
Thanks for having me.
And thank you all for tuning into the deli.
Join us in 2 weeks for another episode.
Thanks for stopping by the Health Deli to sample some of our wares. We're open 24/7 on Facebook and Twitter at The Health Deli, or visit thehealthdeli.com to send us a question or find any of our locations. Please come again. We will be regularly stocking the shelves with fresh content and new wellness specials. As always, we want to give a special thank you to Andrew Tingley and the crew at Ferris State University's Television and Digital Media Production Program. Until next time, so long from the Health Deli, where the topics are tasty, the takes are fresh, and the discussion is free.
Join us in 2 weeks for another episode.
Nice. I actually really like that.
He's into Pirate Day.
He is. This needs to drop on Pirate. Is there such a thing? There is talk
There's
like a
gotta
Pirate
be.
Day.
Yeah, there's talk like a pirate.
Jeez. If he shows up in the next room with a patch on his eye, and then the next room with a pirate, and
I think I have an eye patch somewhere.
Andrew the Pirate.